So dear colleagues, it is my pleasure to discuss my prostate cancer highlights from this year's virtual ASCO GU 2021 meeting. And personally, I liked the presentation on the PSA screening. There was one poster showing that due to the reduced screening in the US, there was a link towards a rise in metastatic prostate cancer. So this leads to my second and very important topic that was presented by our dear colleague, Professor Kim Chi. He announced and presented the final analysis of the phase 3 TITAN study, which demonstrated the continued statistical significant benefit of apalutamide plus androgen deprivation therapy in overall survival in patients with metastatic hormone-sensitive prostate cancer when compared to placebo and ADT. There were a handful of also statistically significant and, from my view, clinically meaningful secondary endpoints, which are also positive, like the PSA response, time to castration resistance, time to subsequent therapy, and PFS2, which I think is an important marker that underlies that it is important to intensify treatment upfront. So important data in MHSPC on apalutamide and the combination with ADT, that intensifying really makes sense in a broad patient population. And basically, this is an all-comer indication. The patients could have been treated before with ADT, could have had chemotherapy, docetaxel, and even local treatment like radiation or radical prostatectomy. So what's on the horizon? Here, an interesting abstract presented by Michael Hoffman on the therapy study. He showed the data on the lutetium PSMA therapy compared to cabazitaxel in men with mCRPC previously treated with docetaxel and androgen receptor-directed therapy, and could show, as we saw last year's ASCO, that lutetium PSMA is a promising alternative. We've seen PFS data positive for this new treatment, this target treatment. However, we will still need to await the overall survival benefit. So we've learned from TITAN that intensification upfront with apalutamide and ADT makes sense. How is it if you combine APA and abiraterone? How does it help in mCRPC? And we've learned at this year's ASCO GU conference that the combination of apalutamide with abiraterone somehow boosts the radiographic progression-free survival in mCRPC. However, so far, no overall survival benefit. So I personally doubt that this combination will really add so much benefit. It adds some financial toxicity. So far, no overall survival benefit. And I think the future will be PARP inhibitors in mCRPC and novel combination, like one trial that was shown in Trials in Progress, the combination of atezolizumab and cabozantinib, the COSMIC-002 trial, which is recruiting worldwide right now, and also the Keynote 641 trial, combination of enzalutamide in mCRPC after failure of one novel androgen deprivation therapy treatment, and in combination with pembrolizumab. So those are the my personal highlights of the ASCO GU prostate cancer topics. And thanks a lot. Thanks for your attention. I'm looking forward to see different modern results in the upcoming conferences like EAU and ASCO 2021. Thanks a lot.